Um, Good evening, friends. Hi, this is Dr. Abhishek Dubey, your mentor for surgical dentistry and corticobasal implantology. Today, I just want to talk about a very exciting case recently which I operated. So, as you can see, there is a CBCT image in front of you. Okay, there are a few salient things I want to talk about this case. So, this is a periapical lesion right here. You can see there are multiple periapical lesion here also. Okay, this bone is very porous. The patient is a 48-year-old male patient who has been operated for coronary artery bypass, and he was on blood thinners. So I did this case not in my clinic, in consultation. So the things which I want to highlight in this case is the bone rim, 1 mm, 2 mm bone on the right side, following the same pattern. Again, in the molars we have 5 mm of bone, and then again 1 mm, 2 mm bone. The advantage is that there is a dense cortical pterygoid area over here and a less dense cortical area for pterygoid over here. So in this case, I have engaged both the pterygoids. That is not the point of discussion. The point of discussion is this gray area. This gray area which is seen above the bone. This is the sinus lining. So the thing which has to be understood that in the same patient, on the right side and the left side, on the left side if you see, there is no prominent sinus lining. Okay, but on the contrary, on the right side you are seeing a very prominent sinus lining. Okay, while doing surgeries we have to keep in mind that the sinus lining can be very thin or very fragile. So in terms of conventional implantology, this kind of sinus linings are beneficial because you get thick sinus lining. You can do sinus grafting, you can do sinus elevation and all. But at the same time, the sinus floor should be smooth. Like over here, if you see, there is the sinus floor, it's smooth in nature. On the contrary, here the sinus floor is rugged. Okay, so doing a sinus lift on the left side will be more challenging than doing a sinus lift on the right side due to the rugged morphology of the bone and the very fragile, friable sinus lining. So the people or the implantologists who are into conventional implantology should take note of this thing. Another important feature which I want to highlight in this image is this orange lining. Okay, people many a times confuse this orange lining with the sinus floor, but since you have the above image, you can make out that the sinus floor is here, right here. Okay, this orange lining is the tracing of the posterior superior alveolar artery. Posterior superior alveolar artery, which is entering the sinus wall from the infratemporal region. So if you are doing sinus lift, your knowledge about this particular anatomical feature, this artery, should be perfect. Means you will have to anticipate its presence, and accordingly you will mark your window for sinus lift, direct sinus lift and all. Coming to corticobasal implantology for this particular case, these cystic areas are to be curated thoroughly during extraction of the root piece. You can see a root piece here, a root piece here, and a root piece here. And after curettage, only the drilling should be performed. There are two benefits of during the curettage in this case. The first being, it will remove this granulation tissue. Okay, it will give you a dry blood field. Okay, plus during the healing phase, there will be lesser chances of implant related fibrosis. Means whatever gaps or voids will be there, it will be filled with bone and it will be replaced with bony tissue, because granulation tissue is rich in multiple varied growth factors. TGF, VGF, PDGF. So we want maximum bone growth. So eliminating the granulation tissue from that site helps in providing a stable bed for the osteoblasts to do the bone laying procedures. Okay. Another important thing which I want to highlight about this CVCT image is while doing a pterygoid, we have to keep in mind that the angulations of the pterygoid implant are very important. Any implant which is placed in a straight manner, has more load bearing capacity than any implant which is placed in a tilted manner, no matter where the bone or what kind of bone is engaged. If it's tilted, invariably its load bearing capacity or occlusal load transfer capacity will be less than an implant placed straight in the same quality of bone. Okay, so for this case, the first pterygoid should be from the tuberosity area, like distal to this second molar, at this particular angulation. Okay, and the second pterygoid will always be transsinus. Similarly, here if you see the curvature of the tuberosity, is more acute, means it's just rising. Okay, so finding a pterygoid mineralized zone is easier in this case. Okay, but here if you see the curvature of the tuberosity is more gentle. Okay, that means while drilling, if you start drilling here, invariably distal to second molar, invariably you will hit the pterygoid plate. But in this case, if you start drilling distal to second molar, you may miss the pterygoid. Okay, so these kind of things we should be aware of, we should bring into consideration, and we should visualize this thing in our brain while operating. Okay, if you are using a guide for pterygoid, then you may not miss, but like I per se, I do most of my pterygoid blinds, never using guides. Okay, so for me, having this kind of knowledge and picture in front of me is very helpful during my surgeries, so that I know that if I am keeping my drill just distal to that means I have an angle of around, if this is the straight line and I tilt it 45 degrees, I am into the right zone. Okay, and then I'll just come 5 millimeters ahead, and then again I'll be in the right zone. So, but here if I do, the same thing has to be compensated in terms of angulation change. Okay, I cannot maintain the same angulation I used here. I have to be more vertical. So the moment I go more vertical, I am in the middle of the fusion zone. That means it will be difficult for me to place a second pterygoid in this area, because the fusion zone is over here. Okay, so if I am placing my first pterygoid here and the second pterygoid here, that means I am going a little higher and I am transversing lot more distance through the sinus. Okay, invariably both the second pterygoids are always through the sinus only in these kind of no bone cases. Okay, that's it for today. Hope you like the concerned information shared in this video. Do share your views and opinions, if any. Would love to help. Okay, thank you. Over and out. Jai Shri Ram.